And by this, we believe that it's a start. This is a start to a wonderful initiative. The start, some of us might have already started, but it's never too late for those of us who haven't to get on board to loving ourselves back to health. We have an afternoon of healthy and inspiring talks that we hope will motivate each of you to take this journey of health with us to the next level. For some, you may have already be a few steps ahead, but while some of us might still be at ground zero, for today, we're going to make that first step to catch you up in whatever it is we need to do to get healthy again. And so, with that, I once again welcome you all to Loving Yourselves Back to Health and Women's Health Seminar. I pray that we all will be motivated and blessed by what is shared today, and that we will start saying to ourselves, I love myself. I love who God made me to be. I love who I am, and I will do all that I can to be the best version of myself. I am fearfully and wonderfully made. Therefore, I will walk in that truth today. Once again, it is my great pleasure to welcoming you, our esteemed guests, and I take this pleasure in welcoming our esteemed hostess for this afternoon in the person of nurse for over 40 years, midwife for over 24 years, nurse and midwife, Sister Anna Forbes. She has been in this industry for a very long time, but she is on a mission to help women have normal biological births. And that's a big thing, right, Sister Anna? That's a very big thing. So she will tell us what we can look forward to this afternoon and take you into our program. Once again, welcome.
Good afternoon, everyone. Thank you so much, Sister Linda. And it's so good to see each and every one of you here today. And you're really in for a treat, a real treat. As you heard from the Women's Ministry Director, Sister Lindell, who is very passionate about that role and in helping women in every aspect of our lives. She was the one who initiated the program. I was just asked and joined and came in, but it was her and her team that taught about such a timely topic. You know, it is said that an ounce of prevention is worth a pound of cure. And we reckon that there are so many things that we can do to help ourselves. When God created us, He didn't create us to die. And He didn't create this body for no sickness. But the good news, ladies, is when this hit me, it was like a ton of work. Christ came to redeem us from the curse of the law, from the curse of sin. Sickness is the curse of the law, is the curse of sin. Christ died to redeem us from that consequence. So, but we have a role to play. So this afternoon, as we dive into menopause and breast cancer, menopause is something we all will face, huh? The only way you escape that, if you're a man, Sister Linda say, menopause, pause from men. Take a break, that's what it means. So we have that, and then we go into breast cancer, which we know, we'll hear maybe some statistics, which we know we have a very large percentage of our population, women, and we are seeing it younger and younger. I believe our youngest patient with breast cancer was either 13 or 14. The person who's coming from Sister will verify that, years old. And we believe that there are things that we can do to minimize or prevent breast cancer. And there are simple things we learn, very, very simple, that sometimes we just ignore. You know? And we wait until the house is falling down. And then we run. But after today, I'm hoping from what we'll learn, we'll do better. And also, a number of persons, once they hear the word cancer, they think that's a death sentence, right? And they live that out. But we'll learn today that that is not the case. In the majority of cases, you can go on and live a very, very long time. Very, very long. I had a friend, she was engaged, she was like 28. When she found out, she waited to have her breast mastectomy and all of that, and then she got married. She's still with us today. Yes? So it's not a death sentence. And so you'll learn all about that today. Believe me, I'm not any of the presenters today, so let me just cut it short. And we have with us Dr. Prince, and I love her. She is somebody who loves the Lord, and she's very, very passionate about what she does. Dr. Misty Spencer Prince is a passionate proponent, educator of healthy lifestyles, prevention, and wellness. When you talk about what defines a good doctor, she demonstrated this, she lived this. She is full of empathy and compassion. She spends unlimited time with her patient, getting that history, make sure giving all the relevant information. Listen here, sometimes when I work with her, I say, 1 hour pass, I have to go this way. So it's not. I say, she comes to the door, I say, that doesn't even faze her. If it's necessary, she will take the time. And listen to me, she don't charge you for that, you know. You can't pay for that service. Yeah? Even though sometimes I figure rather than pay the regular price, that should be triple. But, you know, she doesn't operate that way. She's just that type of a person, wanting to relay the affairs of her patients, to understand so that she can build that trust and that rapport. So she's very, very compassionate and very, very supportive of her patient. She is Trinidadian born, and sometimes I even forget that because she's talk just like us. She is Trinidadian born and educated, and she loves our diet. But she don't eat bad like us now. But she's conscious of her diet, but she got some of that Bahamian taste, you know. She like our Bahamian food too. She graduated from the University of West Indies in 1998, got her qualifications in family medicine in 2005. She's a certified health coach, and she's a fellow of Integrated Health and Medicine. Integrated Health and Medicine. So she's not only the traditional doctor, yeah? When you go there, you can get all that preventive stuff, all the natural medicine, what you can do. And trust me, sometimes I think she's a Seventh-day Adventist. Trust me. She believes in our health principles. But I hear her in their teaching. You know, I gave her the book, Consults on Diet and Foods, because she is such a proponent of God's health rules to govern our lives. So she not only practiced medicine, but is integrated health as well, which is the preventive side of things. Because the Bahamas is home for her, she has worked in the public health system at PMH and the public government clinics for over 18 years. So she has contributed significantly to our wellness and the healthcare of us. And she now works in a private setting for the last 6 years. She strives to live by example and enjoys backyard gardening, baking. She bakes fruitcake, not the traditional way, no rum, no sugar, all that way. She is a health person. And she's happily married to her husband Sheldon for over 24 years. And together they have 4 amazing children, ages 22 to 13 years. Trinity, let's put our hands together as we welcome Dr. I can say all them names. She want me to say all them names. Dr. Misty Spencer Prince to share with us all about menopause.
Thank you very much, Nurse Forbes. And she told some of my secrets. Nurse Forbes is really a gem. She is really a gem for us in our clinic. And her heart and her, just the totality of care. So thank you so much. And thank you, everybody at Trinity SDA for inviting me and for having me here to share on understanding menopause. Okay, great. So you're all seeing it too. All right, so we can start. Next. All right, so this is going to be a little bit interactive. Okay, so don't get too cozy in your seats. We're going to define what menopause is. We're going to try and understand how it works in the body. We call it physiology. I'm sure you could tell me all the symptoms of menopause. And we're going to look at treatment options before we end. Simple? So before the next slide, I want somebody to think of and even share with us what you think menopause is. And I really applaud the men in the house, because it's not just a woman thing, it affects men too. So thank you for being here. So anybody want to hazard what menopause is before I give you the answer? Men on pause, is that it? Sorry. Exactly. So my sister said menopause is about changing life from being able to bear children to not being able to bear children. That is the practical definition of menopause. So you're right. It's a change in life, and it's not just a change. It represents part of the aging process. Okay? So next slide, please. Right. So according to the American College of Obstetricians and Gynecologists, they agree with your definition. Okay, so this is supposed to be one young lady who is changing life. Her body is aging. You see certain features in her face are changing, and she's still beautiful. And that is one thing, as some of us in the room aren't in menopause stage as yet. Some of us are approaching menopause, and some of us are way established in the menopausal region. Ladies, you pick where you are. But regardless of where you are, I want you to know that you are beautiful. Okay? Next. So this is a busy slide, but the reason why I put this up is to show the fact that this menopause process is quite complex and quite complicated. It involves our brain, and there are 2 centers in our brain in particular, one called the hypothalamus and one called the pituitary gland. Okay, those 2 are found in the brain, in particular the anterior pituitary. So the pituitary gland has a front side and a back side. The front side is the side that is responsible for releasing certain hormones called FSH and LH, follicular stimulating hormone and luteinizing hormone. And those hormones leave the brain and go to affect the ovaries of the woman. When we are born, like that, that's a little girl there? A boy, okay. I saw a little girl walking with her family. When little babies are born, little girls, they have a certain number, vast number of potential eggs. And as that little baby grows up to enter puberty, what happens is that those eggs now become ready to wake up, and those puberty hormones kick in. And once she starts to see her period, we call that menarche, then she is eligible to become pregnant. So those eggs that have been sitting dormant and quiet in the ovary are now waking up. Well, menopause is the opposite. They go back to sleep. All right? Or more, not really asleep, they just get used up. Right? So that's where the we have two ovaries, one on the right, one on the left. And the ovaries start to fail in their function. And that's what menopause is. So that means that the eggs or the follicles, that's a fancy name, can't be stirred up to life anymore. And as a result, the things that the follicles would have produced, the hormones, are no longer in the high levels as they used to be. And guess what? The primary hormone that the eggs or the follicles would have produced is called estrogen. Yeah? So estrogen, there are different subtypes of them. There's estradiol, there's estrone. But the point is, the different types of estrogen that our bodies produce helps us women to be women. That, people that men enjoy. The curves, the skin, what else? We have some delicate airs here, so we can't go that far. But you understand what I mean, right? The hair and it also helps our heart health. Having estrogens help our heart health. Having estrogens help our bone health, our joint health. It helps, as I said, the vibrancy of your skin. So when we go into menopause, because the ovaries fail and the follicles no longer exist to produce their good stuff, then what happens is that all of that gets pulled away over time. So that's where you hear women complaining of hair loss. They complain of what? What do we complain of? Hot flashes, yes, or hot flushes, depending on who what you're saying. But we know hot flashes. What else do we complain of? And this is going into symptoms. What else do we complain of? Yes, night sweats. So hot flushes and night sweats are the two most common symptoms that women have when they're entering menopause. And mind you, not everybody going through menopause will have those symptoms, but a lot of women do, okay? What else yes, ma'am? Yes, so once your cycle, and thank you for raising that point. Once your cycle has stopped and it remains gone for 1 year, you are considered to enter into menopause. Thank you for that. So that means that, let's say you're a young lady, or not so young lady, and you are, let's say, menopause is generally thought to occur between 45 years and 55 years. So let's say you're 48 years, your period came every 26 days, and you notice for the last couple of months, it's now every 30 days, sometimes 33 days, sometimes 23 days. So there's a period irregularity. You're in that phase just before menopause. Yes, perimenopause. skirting around, dancing around the door. Okay? Once your period has stopped, you cannot say, oh, great, I'm in menopause now. No, you're not in menopause now. You have to wait 12 months of no period. And then after that 12 months, then you could rejoice. Because that's important. You know why?
Y al final vamos a ver cómo queda
Who could tell me why?
2024. Y yo creo, pastor, que es importante.
Huh? Your period could come back, which means that you can? Ah, yes. Your pension baby. Okay? So, babies are blessings, don't get me wrong. But at this stage of life, most women don't want a pension baby. So you have to still take your precautions, yes, until 12 calendar months consecutively have passed and you don't see a period, and then you could say, I'm in menopause. Now, in medicine, as Dr. Monroe will acknowledge, we say never. And things could still happen, but generally, 12 months, menopause, no baby, okay? All right, great. Next. So we talked about this already. Okay, just to put a classification, we call the hot flushes and night sweats, we call that vasomotor symptoms. Why? Because estrogen has an effect on the blood vessels to determine how wide they are or how narrow they become. And so when estrogen is missing, the body goes bazookas, and we have dilatation of the blood vessels, the arteries, and that can cause these sudden, unexpected, and often unwelcome periods of heat that occurs the head, the neck, the chest, and profuse sweating for many women. And it occurs more in the nighttime, the night sweats, that's why they call it night sweats, as well. I also would find that women say, oh, I tend to gain weight since my periods are just behaving wonky, I'm putting on weight. And again, all of that is because of the body missing estrogen, okay? When women go into menopause as a result of not having as much estrogen, the body is at increased risk of heart attacks as well, and brittle bones called osteoporosis. So menopause is something that you really you shouldn't ignore, and shouldn't say, well, okay, I'm not seeing my period, life as usual. No, it's a wise thing to know what to do to keep your body still functional and well. Next. And this is another diagram saying the same kind of thing, looking at the organ systems, the different parts of the body, and you'll see mood swings are there. Men in the house. Any man could say yes. I'm living with my mom or my wife, menopause, and fly off the handle easy. Yes, I see women laughing. So you all know who you are. It's not all quote unquote bad mind. It can have a biochemical hormonal factor to it. So you just being aware, and this is what this seminar in my head is about, increasing the awareness so you know what to expect if it comes, and you know what to do to avoid it, yes, or counteract it if it does. Also, I would also say vaginal dryness, skin dryness, and increased risk of urinary tract infections, right? Burning in the urine, having to go more often to the bathroom to pee, just being uncomfortable in that female area can all be a symptom of menopause. Next. So this is the part that I'm sure that you want to find out more about. Treatment, okay? The integrative health way. Now, integrative health is a holistic way. It's a total way of looking at the person and individualizing the care for that woman, in particular going through menopause. And so, in addition to proper sleep, the basics, proper sleep, a healthy diet, and so forth. There are using drugs to help with the hormonal effects of not having or being in menopause. And so you will seeing that estrogen deficiency or loss or lack of estrogen as is the cause of the symptoms, then it would make sense that, thank you, you get some. And you get some through medication. Okay? Now, the medication, as you see, can come in different forms, whether it be by mouth, whether it be a spray, a gel, whether it be under the skin. But the issue with estrogens is that when you give it to a woman, there is potential side effect. So you and your doctor need to sit down together and go through the benefits of being on it versus the risks, and weigh it out for you. And the risks include increased risk of breast cancer, endometrial cancer, ovarian cancer, and then other things like nausea, muscle spasm, diarrhea. Okay? Now, the increased risk of cancer may be small, but to me, any small increase is something that I need to think long and hard about. So you need to sit down with your healthcare provider and sort it out, talk it through, okay? There are other ways as well to deal with the menopausal symptoms outside of using estrogen. But estrogens are the most effective way, especially if the night sweats are bad and the hot flashes are bad. There is, the current recommendation is that you use the lowest effective dose for the shortest time. Okay? So in that way, if you get put on estrogen oral medication, it's not ideally to be had for years and years and years and years. Okay? I had she's in her 70s, lady who came in and she was on estrogen for the last 20 plus years. Mind you, she looked nice. She looked, the skin is plump, the breasts are up, and she's in her 70s and she's of a Caucasian extract. So I said, this woman is aging beautifully until she told me why, which is she takes estrogen. But the point is, you don't want to be stuck on that pill for longer than you need to be, okay? And the other medication is progesterone or progestogen. And essentially, that is oftentimes thought of as the counter to estrogen use. So if you're using estrogen, it is wise to use a little bit of that progesterone to it to reduce the risk of endometrial cancer. But that in itself has other side effects, potentially. Next. So more treatment options. You have the non-hormonal type, and they include using antidepressant medication. You see a lot of acronyms up there, but the point is there are other medications that can be used to help reduce the hot flushes and the night sweats, okay? In particular, I don't know if anybody has heard of an antidepressant medication called Paxil. Yeah? Right, so that at 7.5 milligrams has been recommended or is approved by the FDA to treat the hot flushes and the night sweats. Other non-pharmaceutical options include other modalities like acupuncture or yoga, and these are said, they're not quite sure totally of the science behind it, but they know that it helps to increase the amount of good neurotransmitters, the feel-good neurotransmitters called endorphins in the brain, and that makes you feel good, okay? There are botanicals or herbs through supplements There are mind-body techniques and nutrition, as well as exercise/movement. So there are other ways outside of the estrogen that you could try and get a handle on your symptoms. Next. So in particular, black cohosh, I don't know how many of you all have heard of that. Yeah, St. John's wort as well, have been recognized to help with the vasomotor symptoms, the hot flushes, and the night sweats. And there's another one, that one with the long word down there, and the long words down there. I have not personally used that one, but the black cohosh I have used in clients prior with good relief. The thing with herbs, supplements, botanicals, is that you have to get high quality, good brand. You can't just go on Amazon and say, doc say black cohosh, so let me, and look for the cheapest thing and put that in your drug cart. Because you're not quite sure if it's properly vetted, third-party validated, you have to make sure it's not, doesn't have any contaminants to it, and there are certain labels you look for. So the quality is very important. Next. Mind, body. Anybody has heard of the term mindfulness? Yes. Mindfulness is a buzzword in our part of the world these days, and that has to do with learning how to take how you're feeling. It's usually used for chronic conditions, especially whether it be anxiety, depression, commonly. But take how you're feeling for menopause. Take the hot flush when it comes, and not react automatically to it. But recognize that, oh, I'm having a hot flush now. All right, call it for what it is. Know in your head that it will pass temporarily. Usually it lasts less than 5 minutes, but for some women it may last a bit longer, but it doesn't last forever. And then you're able to calm yourself and just breathe and just keep perspective. That's essentially the core of mindfulness. And if you exercise that enough, then it will come to you without you reacting to it with anxiety. You see? So mindfulness can help. Relaxation exercise, right? How many of us women have a 20-minute routine that we do every day where we do something that we enjoy? Nobody. Okay, so whether you're going through menopause or not, this is a good habit to employ. And I know, yes, I'm guilty of it too, because life is a rat race. And then the children, then the husband. Dr. Monroe. We have a running joke with that. But the point is, whether you're male or female, taking self-care is important. So find something that you enjoy to do, whether it's reading a book, listening to some music, what else you may enjoy doing, I don't know. Gardening, yes, gardening is beautiful. Being out in that sun and talking with your plants, man, that's the best. Therapy, free therapy right there, right? But relaxation exercise has been found to reduce the stress response reaction that can be associated with menopausal symptoms. Hypnosis as well, and the form of hypnosis is what is called like guided imagery or safe place imagery, where you essentially, through the power of your mind, you are able to think of being in a safe place, a cool place, and just kind of live there in your mind. There are experts who can help with the process. I have my views on it, but it's just to let you know that it's an option up there, as well as cognitive behavioral therapy, which is similar to mindfulness in a lot of respects. Next, nutrition. Yum, yum. I am hungry. Look at that. Isn't that beautiful? Yeah, the colors, the textures. High calcium foods can be thought, or it's suggested that we women facing menopause, in menopause, need to stock up on. That helps with building bone health and ensuring that you don't have these brittle bones, osteoporosis. And it is recommended that you really depend on vegetable, plant sources to get it more than dairy. Yeah, we know about drinking our milk and eating the cheese and having yogurts, but oftentimes, especially these days, persons may have sensitivities to lactose. We're not quite sure how they're feeding the cows, what substances are being pricked into the cows. It's just a lot of hazy areas. So the recommendation, the integrative health way, is depend on more plant sources. So that's your dark green leafy vegetables. And as SDA, as Seventh-day Adventist believers, you know what they are, yeah? So high calcium foods. Fiber and healthy fats, very important. They not only help, fiber in particular doesn't just help with bowel health, but it also helps, along with healthy fats, with heart health, okay? So we want to make sure that we're using avocados. What else? You tell me. Nuts, yes. The walnuts, the olives, okay. They're just so high in salt, but that's okay. Go ahead. What else? Sunflower seeds, yes. And you could look on the slide and see all the other things as well. Okay. But I said avocados, but you want to be able to eat a variety of foods to be able to get your healthy fats. And that includes the oils as well. Avocado oil, I see they have it in Super Value Winter and for an ungodly price. But it's there. It can take high heat well. So instead of using your soybean oil or the other seed oils, you can make an investment to get a little avocado oil and say, this is only for me for right now, and use the canola oil for the children. You know what I mean? Just being very practical, okay? Coconut oil and so forth. So healthy fats are what you want to focus on. Fish is included, cold water fish. And then also fluids. So many times I see patients in the office and they don't drink enough water. I mean, 60 to 70% of our bodies are made up of water. So if all I'm drinking is 2 cups, that doesn't make sense. Really, it's half of your weight in pounds is the number of ounces of water you should drink. So if you are 220 pounds, that works out to be 110, half of it, 110 ounces. And you might say, so, okay, great. How many cups is that? Divide that number by 8. That probably wasn't a very good example because to do the math on that, it's a little bit brain work. But you get the point, right? Okay, next. And also with respect to fluids, coffee may stimulate or increase the risk of the hot flush, night sweat. So you want to avoid coffee, okay? And while black teas and green teas have their good benefit, because they have some degree of caffeine, you may want to waive that as well. So everybody's body is different, so you have to know what works for you. And hot drinks can promote hot flushes more than room temperature drinks. So just bear that in mind. And lastly, exercise. Exercise, exercise, and exercise. And I love this picture. You know why? Because they're not skinny. They're real people. I could see aunties and grandma and sisters in there, right? But it doesn't matter what you look like, your ability, get out there and walk. If you could jog, do a little jogging in between. If you could swim, do a little doggy paddle, but do it, you want to do it at least 5 times a week, about 5 to 6 times a week, and at least 30 minutes, okay, each time. And then you can build from there, okay? And you also want to do weight-bearing exercises. So you want some level of resistance, and that level of resistance is going to help build bone health. as well as build muscles so that you can burn more calories so you can lose the unhealthy fat. All right? And that helps with not just the improving your body, but also helping with mental health. The stress, you feel tired, go and exercise. Next. So that's my bibliography, where I got the information from. And thank you very much. Next. Any questions? Yes, ma'am. I wouldn't call myself a menopause expert. As a family physician, I treat patients throughout the stages of their lives. But I think at the age and stage where I am, I appreciate it more fully. So I could empathize with persons going through the motions, you know. But no, I'm not exclusively a menopause doctor. Yes, ma'am.
If you're perimenopausal, how long does that take usually? How many years or months or what period do you remain in perimenopausal? And the second one, does a IUD affect that process at all?
Okay, so for you, the first question, there is no magic number. So it could take 3, 5, even 10 years, right? Before, hanging around perimenopause to become menopausal. Some women enter perimenopause from 40, some at 45, some at 48, and then see the cessation of their periods 1 year, 2 years, 5 years, 10 years down the road. So there is no magic number. Okay, so I think you can get a guide from looking at your family history, in particular your mother and your sisters. That might be able to be helpful. I know of one case where this lady had, I think, 3 sisters, and she was the oldest, and her journey to menopause was rough. So she decided to warn her sisters, and she discovered there is a supplement that worked well for her, and she decided to let her sisters start taking it at a particular age. And the one sister that is my friend, she took that particular supplement, and she said she's so grateful because she didn't have that experience that her older sister had. Now, who is to say that she would have had a bad experience like her older sister? But she didn't know, but she wasn't about to take the risk. So the point is, you may get a guide for what may occur with you by looking at your immediate family. And the IUD there are certain IUDs that are associated with progesterone. So IUDs that have progesterone in it can be used while the woman is on estrogen therapy. But to say outside of that, a woman having an IUD that should not, unless it's a highly progesterone-filled IUD, it should not affect when she goes into menopause, if that makes sense. As far as I know, I could stand to be corrected. I think your gynecologist could better speak to that. Yes, sir.
Thank you. I always just felt that the word menopause was just always so, was not a good word.
Yeah.
Beginning with men, because men have been nothing but kind to women.
Really?
As we go back all the way to Garden of Eden, extending to them a rib. But now to what I'm going to say. Just as the word say, menopause. During this time, how does that affect a woman's desire for sex?
Thank you for that point. Actually, menopause is actually Greek. So meno, M-E-N-O, has to do with months, and pause, of course, cessation. So I'm guessing it meant the cessation of the monthlies. So that's where we just joke around with men on pause or men, but it's really Greek, and With respect to that, one of the symptoms of menopause is for some women reducing in the desire for that kind of intimacy. Perhaps they don't mind the caressing or but the more in-depth penetration act, they may like, And that may be because it may be a mood thing. So, the anxiety or depression, just not feeling it, right? Not feeling it. And the thing is, it's a balancing act because women are married, and we know married women have obligations to their husbands. And God said certain things, even in spite of this. But I think at the end of the day, it's the act of love that would help both men and women to overcome the obstacles and challenges. So if your wife is struggling with that area, I think it's finding ways to still express love. And I think a good woman, with a good man, as you say, men have been nothing but good to women, would come around, would come around. It's just instead of attacking it head on, it's just like, well, give me a little bit of romance kind of thing, and just being there for her, I think is going to yield dividends later on. But it is a trial. It is, and I could see how for men it can be a trial because while men go through their own andropause, it's a bit different when it comes to the woman. So it's understanding your wife, being able to talk through concerns, being able to enjoy each other, and then being able to negotiate. I'm sure women, and please don't let me be out on a ledge here. Please say amen or whatever. Where, a rub to the neck. Yeah. A massage to the feet. I'm giving you ideas, sir. All right. All these things go a long way. But yes, menopause can contribute to the lack of desire. Okay. Yes, sir. Yes, ma'am. Yeah.
She intentionally don't want to have a relationship with her husband. It's just that her body is going through a lot of stuff.
Yeah.
And some men just don't understand that.
Yes.
And then another thing is, in this culture I live in, many men have a high sex drive, and because women are going through things, many of them decide to go and have sexual romance with a younger woman who is not going through that.
Right.
And so women have to deal with a lot of challenges during this time of their life, and men need to be educated in regards to what the woman is going through.
Exactly.
Isn't that she want to go through it, it's just that that's how life is.
Yeah.
But I think men need to be more understanding and just focusing on, they have a need and they need to do whatever, I think if they, go with the woman to the doctor and both of them be educated in what is going on, I think it makes the transition much smoother and easier. It's just that I think the husband he don't have the understanding or the knowledge to understand and comprehend. There are other ways that both of them could show love for each other. But we just need to understand what are some of those areas that you need to be educated in. And sometimes as Black people, we are not willing to do certain things to make our husbands, whatever.
Right.
Because we are not used to that. But we just need education all around. That's how I see it.
Yeah. This is why I applaud your community because and the men who came. Notice I did say from the get-go, that I applaud the men because it means that your community realizes that this is a need, and the men in particular in the community are there supporting the women. So I think this is a step in the right direction, and I do agree with you. I think I'm getting a cue. So thank you so much for your time and your attention, and I trust that with this information, both men and women are armed to walk through menopause more smoothly. God bless.
Weren't your heart blessed today? Yeah. Did you learn a lot? Oh, yeah. Dr. Prince, on behalf? Yeah. I said Prince. On behalf of the pastor, elders, members, our women's president, Sister Dell, we want to say thank you. Thank you for taking time over your busy schedule this evening to be here with us to educate us on menopause. So we want to say thank you, God bless you, and do enjoy your fruits.
Thank you so much. I appreciate it.
Thank you so much. We're going to just have two quick testimonials. The person who has traversed the metaphorical stage, share with you so you can understand. Some of this might be different, but they wanted you to be happy to have them come and share. And the person was Sister Sherry Larimore, and she will be quickly followed by our elder Sister Doris Robinson. Give them a hand and say that.
Good evening and happy Sabbath. My testimony ain't gonna be easy. This is like I went through hell and back. I don't know what was going on with me. I thought I was losing my mind. No one sit me down and tell me, Sherry, when you get a certain age, this is what's gonna take place in your body. And when I hit 13 years old, I still didn't understand what's going on in my body. Because I thought I was still a child at 13. Why am I seeing menses at 13? And then coming from a black family, black people are scared. My mommy really embarrassed me. I thought the thing was ketchup. Didn't know it was blood, And I just think that in our culture, we need to be educated when it comes to our bodies. Because many parents don't know how to explain when their daughters are going through menses or menopause, what is going on, because of lack of understanding. Many young people are left in ignorance, darkness. For my case, right, with menopause, I was only 47 when I started menopause. And I really didn't know what was going on. I went to Princess Margaret Hospital, I see this doctor, I see that doctor. I was just losing my mind. I didn't understand. Okay, seeing my health every month, but now I'm not seeing what's going on. So the doctor had to calm me down. She noticed, calm down. I'm going to educate you here. Every woman that has a womb goes through menopause, okay? You're not the only one. Every woman will go through what you go through. Everybody goes through it differently, but you will go through it. Some of the symptoms that I experience, number one, hot flashes. Sometimes I feel hot, sometimes I feel cold. Sometimes I don't know where I am. Sometimes I feel like I'm going out of my mind because I can't sleep at night. I have these crazy dreams, okay? I never used to feel like this, what is going on with me? And then I had to go on Paxil, okay? The same thing the doctor's talking about. And that helped me a little bit. But I think I suffered a lot of anxiety because my body I wasn't feeling good. And no one could explain to me, Sherry, when you reach this age in your life, this is what's going to happen to you. And I think I was educated or made to aware that this is what was going to happen to me, I would have been able to transit it through more smoothly. And this is why I wish in this culture there was clinics or foundation or someplace where women can go and talk about any issue in regards to their health. But I don't know of any. I don't know if there's any kind of groups where women can go to and talk about women's issue. Okay? And I wish to God we could have some place like that. Because God knows I really did need to go there and talk to real people who are experiencing real issues with menopause or real issue in regards to anything that is regards to their health. Because I think when you go for me that if we had probably in America, they have different groups and organizations for women that could deal with women issues. Women can go there and talk about any issue, you know what I mean? And everybody shares their experiences in regards to what is going on. Because I even went to my church and I asked women I know, I said, tell me something about menopause. So some said, I put on my dress backwards, I was going crazy. I put it on wrong, sometimes you put on your dress wrong, you don't know if it's all right or wrong, okay. And one said she had a heavy bleeding, then the next one said she, it's probably getting swelling in her legs, or, you don't want to have a relationship with your husband anymore, the desire is not there anymore, the man don't understand these things, he thinks you're just trying to push him off. It is not that, it's just that the woman is not feeling herself, she's not the same, her body is going through, something different that she's not unfamiliar with. And I just wish to God that men will understand that women go through things. It isn't that they're trying to play crazy or the woman just acting iffy. It's that she's going through stuff. Explain and just right. And all she needs a husband to have is a listening ear. For God's sake, just listen to the woman. Listen to what she's saying. Be there for her. Have a listening ear. Cuddle her or something like that. Hug her, Go through the hospital with her. Talk to a professional about these things with the woman. Support her. Sometimes you just need someone to listen to, someone to hug her, someone to support her, okay? And so, all I could say to women, just pray. That's what helped me, pray. And that's my 5 cents, okay?
Good evening, all. One of the things she mentioned is exercise. I think I overdid it and pulled a muscle in my leg. But I remember my period started at 10, and one of the things that was said is that when you have early period, then sometimes you have early menopause as well. And so at 47, my period stopped. I didn't even have the little lead up to, sometimes it stop and go, it stopped. And from then, I had what I call the rage. I actually had a name for it, the rage. Because I sort of had split personality, like a Dr. Jekyll and Mr. Hyde kind of thing. And I remember I worked at Great Cliff at that time. They said, Doris, you were such a nice person. What happened to you? I didn't see anything wrong, but apparently they did because I became short-tempered. I think now too, a little bit. If you have something to say to me, get to the point, don't beat around the bush, I ain't got time for that. That kind of thing. So that's one of the things that was happening then. I kind of knew what was going on because I read and I love reading. I read everything, whether it's physiology or psychology, that's me. And do you know, as time went by, I decided to stop working full-time. In 2012, I decided to stop working full-time because I didn't want this Doris on other people. I didn't want them to experience the Doris I was at that time. And so I stopped. But what I want to say to you that is very important, and I learned it later on, it has also to do with what you eat. I have discovered, and this much later, after I went through some terrible times, not as bad as my friend. I didn't thought I was crazy because I always was crazy. But what I've discovered, I became a vegetarian recently. I mean, complete vegetarian. But what I realized is when I stop eating processed food, and that's anything, whether it's macaroni, whether it's cake, whether it's cheese, whether it's whatever, I feel the rage. You know, you feel the hotness come in your head, and it just moves. And it's a terrible experience. Everybody don't have this, but one of the things that makes it so terrible, I have no control over myself. I don't feel like I have any control. I try to change my thoughts and my feelings, but I can't. That's what I didn't like about it. That feeling like I had no control. But I'm happy to tell you today, I have some control. And I think if we are educated, like this lady said, and doctor, I think we can walk, feel, and act. She mentioned something I just want to touch on briefly. A lot of times men look at you, because even when I was working, they said, you know, when you tell them about things, the men and other people, they smile and say, oh, that's just an excuse. So when you tell them things, they're thinking it's an excuse, but it's not an excuse. And I think then too, we even didn't understand it fully. But I'm so happy that nowadays there are places you can go and people that you can speak to that help you to realize that indeed your body do go through changes. And so you just have to come to terms with them. Thank you.
Ladies and gentlemen who are here, are you enjoying this wellness seminar? Yeah. You like the information you're hearing? Yeah. And I'm hoping, I like to see the gentlemen here, and men talk, so the ones who are here, you all need to share with the ones who are not here. And I'm hoping that because of all this information, it will make that transition much, much, much better. The Bible says that we are fearfully and wonderfully made. So ladies, let's say it. I am fearfully and wonderfully made. Nothing to be ashamed of. God made us the way we are. And for a reason, right? We are special. Okay. Now they tell me don't talk long, so I'm not going to talk long because our next presenter is here. Really and truly, he needs no introduction. And I am so thankful that I have the privilege to introduce him. Because a lot of times we say things to people when they're dead and they can't hear that. But it so happened that he's alive and well, so he can hear me. And some of the things I'm going to say about him, I tell him it all the time. Dr. Monroe, I have known him from the beginning of my career, over 40 years. I met him as an intern, and he was always meticulous. And I knew I wanted him. If ever I have to have surgery, he has to be the one, the only person who will lay that laser or knife to Anna Forbes. And I just tell him, if he in Timbuktu and he get that call, he better reach a Nassau. And I know he will because he's a man of prayer. Yes. And the Lord will have him here. And he actually was the first doctor, surgeon from Rugged Island. That's where he's from, Rugged Island. He was the first one out of that island to become a physician and a surgeon. Clap if you want to clap. Good. He did studies at UWI and in the US, and he's very, very, very compassionate and caring. And that's what makes a good surgeon in my mind. Very compassionate. Not arrogant, He got a world of knowledge. Brilliant. But he's not arrogant. Very, very humble. And he loves the Lord. I have so many things I could say with him. He also is, I want to say certain things. I really want to say certain things. I know it's time, but this is important. He is, since he came home, he was a co-founder for the Sister. He's very passionate about treating cancer and finding a cure for cancer. If you dream you have cancer, that's the man to see. Big on preventative, big on explaining. He don't rush you by. He sit down. Sometimes he's got all kind of drawing. Like the drawing, draw that. Let you look at that. Yeah? I like to explain. Takes time to give you options and let you make your decision. As I say, he is so good because he's diligent, he's done his work, but God guides and directs him. Amen. You know, I have a little quote here. A surgeon should give as little pain as possible while he's treating the patient, and no pain at all when he charges his fee. that was just to make us laugh. He is in his work, professionalism in treating cancer or whatever surgery is unparalleled. Unparalleled. Best surgeon in Nassau, best surgeon in the US, best surgeon in the Caribbean, best surgeon globally. That's my Dr. Monroe. And so I am just delighted to have him here. His main goal in life, listen to this, his main goal in life is to alleviate sickle cell disease and to cure cancer. And so I am so delighted that he willingly consented to come to share with us some of the passion about breast cancer. So let's give him our undivided attention as he comes.
Good evening, all. I think she just put me into more trouble than I had planned to put myself into. And to go back to Dr. Spence, I always say to the women that the problem isn't really with the women, it's with us men. And I want you all guys to listen to this closely now, right? God created Adam, and he put him in the Garden of Eden, give him his job, give him his real estate and everything, give him all his helpers. Adam said, Master, but you haven't given me the helper that I really want. God put him to sleep, take out the rib, and give him a woman. And ever since, he's been having problems, right? When you look at Samson and Delilah, when you look at David and Bathsheba, when you look at what Job's wife said to him, curse God and die. I say that, and then the other thing you all been talking about, your mood and all the rest of that. Guys, our testosterone is up here when we're young. Every time you look at them, yeah, right? But then as we get older, it kind of go down, right? You go for andropause. But you know what the difference between us and these women are? Every day, they have a different level of hormones. So today, they are one thing. Tomorrow, they are something else. The day after that, they are something else. It keeps going up, and then it comes down. That's why they drive us crazy all the while. They change every day. Anyway, that's one of the discussions that myself and Dr. Spence always have about why is it that women are so different from men. We are different. We are one and the same. You all come from one place, but we are different. So, yes. And Anna just kind of make me a little afraid to come up here, cause me to tremble when she talk about those things. But anyway, today I'm hoping to give you some information about breast cancer, which is a really, really serious issue. Cancer on the whole is serious. And I always say to folks, I did it in pathology, so you knew about it. When I came home back in 1982, I saw this young lady bleeding to death on the gynae ward. All of her blood was pouring out through her vagina. She had cervical cancer that eroded through the posterior fornix of the vagina into her pelvic vessel, and that lady was lying there and bleeding to death. And I just kind of stood there and, what is this? You know, you read the thing in the books, that's fine, you may have seen it, but now this is reality. How do you get to this point? What is this thing all about? And that really triggered an interest for me. She talked about sickle cell and cancer. Similarly, got a prize, go to London, and they were talking about the genetics of metabolism. So we did a lot of DNA analysis and so on and so forth. And they were talking about bronchopneumonias and bronchiectasis in Jewish folks. In Jamaica, a lot of the people suffered with sickle cell. So I said to myself, why not deal with sickle cell instead of bronchiectasis? And then when I saw the cancer, that was my second step. But you come home and you are hit in the face with various forms of cancer, and breast cancer is one of those things that really, really is prominent in this country. Next slide. And this presentation was made a long time ago. We talk about cancer, we talk about breast cancer. What is cancer anyway? Cancer are cells that are behaving without regards to the need of the body. Our cells always respond to what is needed. Meaning that if I make a scar in you right now, you get injured, your cells are going to turn over until you have healed yourself. That's what it's supposed to do. And then, once that healing process is completed, those cells settle down to their normal cycle. Cancers don't do that. And that little diagram there, just to show you, to give you an idea, what is the difference. Normal cells are very monotonous. That's the one over on this side, right? They are monotonous. And again, from a scientific standpoint, and I believe in science, what is measurable, but they are immeasurable things. The cells are uniform in size. There is a 1:20 ratio for the volume between the nuclei, that's the black spot, and the total volume of the cell. That's normal. And it sits on what we call a basement membrane. You can get what are called a benign tumor or something that is in situ. And what that really means is that those abnormal cells have not gone through that basement membrane. And then that third picture, the one where the red writing is, that shows you what cancers really are. That those cells, abnormal, they have invaded into your body. They have gone through that basement membrane. That's the definition of cancer. That those abnormal cells that are not responding to the needs of your body have invaded into the tissues. That's what a cancer really is. Whether it's in the cervix, in the uterus, in the breast, in the colon, in the brain, in the lung, cancers are abnormal cells behaving not with regards to your body and that are invading into the body. Next. Okay, here's a lady lying down. I don't know if you can see it, but there's a lump right there on her breast, just to the inside, upper inside of the nipple. It's right there, you can see it. Lucky. Next. And yeah, y'all guys, I blame you all for something like this too. The ladies get blamed, never mind, but you all get blamed. If this is your wife, how can you be lying down with her every night? And one of her breasts is that size and one is the other size. Honey, what's wrong with you? Something ain't right. We need to deal with this. And I can tell you, if you think that's bad, you're going to see some worse pictures than that. Next. Well, this is your mammogram. You can see a lot of folks say they don't like mammograms. They squeeze the breast, they smash it on, it's radiation, it can cause cancer and so forth. There's good and bad in everything. And here's a mammogram that shows you that little gray spot right there. It looks speculated, like when your windscreen is broken. That raises a suspicion. Those are the kind of lesion that we would like to biopsy in one way, form, or the other. Those need to be biopsied to confirm what they are. Because I'll say to you, well, you know, I think that may be a cancer, that may be. The biopsy confirms exactly what that thing is. Next. Again, this is some of the things that you see on a regular basis. Next. Yes. Those are the kind, and that is just one of many. And again, like I say, this isn't anything to do with just that lady herself. It has something to do with her support group. And again, we come into it nearer to the end of the presentation. Health isn't just the absence of disease, but it's a state of mental, physical, and social well-being. Where is your support that you are allowed to deteriorate to this point before seeking attention? That is a support issue. Next. So what are my chances of getting a cancer? Well, 1 in 8 women, 12% of women throughout the world are going to be impacted with breast cancer. If you think about it, we got something like 7 billion people in the world. Half of those are women. That's 4 billion. So you could figure out how many breast cancer we can see. 1 in 12 of those women, 1 in 8, 12% of them are going to develop breast cancer. And in my experience, 2 out of every 5 breast biopsy that I've done have turned out to be malignant. So that's like 40%. So if I were to see you and I say, oh, well, you don't need a biopsy, fine. If you need a biopsy, 40% of those are going to end up being breast cancers. Next. Guys, you're not exempt. Not a whole lot, but about 1 in every 100 cases of breast cancer that I've seen have been males. And gynecomastia is one of the things that can perpetuate that in the male. Next. Well, I don't have a picture of gynecomastia, but I think you all know what I'm talking about. Next. Again, why do cancers kill you? Bleeding, infection, and the spread of the cancer to the bone, to the lungs, to the liver, ovaries, to the gut, to the brain. Why do cancers? Now, I need to clarify this a bit. I'm saying cancer, and really and truly, I'm speaking about carcinoma, because you have carcinomas and you have sarcomas. And carcinomas come from epithelial cells. And that's like the lining, like the skin and the lining of your mouth, the lining of the womb, and so forth, the ductal lining in the breast. Those are carcinomas, adenocarcinomas in particular, squamous carcinomas. Sarcomas happen with the fat cells, with the muscles, and so forth. Carcinomas tend to spread via the lymphatics, whereas sarcomas spread via the bloodstream. But even with the lymphatics, those cells eventually get into the bloodstream, they get into the lungs, and then they go to tissues that have the highest blood flow in your body. And one of the highest blood flow in your body, obviously, is to your brain. The next highest is to the kidney, and the bones have a really, really high blood supply. That is why cancers tend to spread to those places, because that's where the blood flow is at the highest rate. The kidney have to filter your blood 120 times a day. So basically 120 times your blood goes through the kidney. If there's a tumor in there, it acting as a filter, a screen, it's going to pick out some of those cells. Same thing with the liver, same thing with the lung, same thing with the brain. It has a high blood flow. And that is why tumors spread to those places. It's no mystery. Like I say, there's science behind all of it. Why does it happen? You just have to dissect it and figure out why it is that it goes to the liver. Why does it go to the brain? Why does it go to the lung? Because of the blood flow in particular. Next. Not just to give you some idea as far as breast cancer is concerned. It goes to the lymph nodes, go to the brain, to the lungs, to the bone, to the liver. All those places it goes. Next. That's end result of spread to the lungs. You get what we call a pleural effusion. The tumor has spread to the lining of the lungs. It irritates it, like when there's a grain of sand in your eye and you start having tears in your eye. When that thing gets into your lungs, it irritates the lining of the lungs and it causes fluid. And this is where confusion comes at some point. They say, oh, well, they say I had breast cancer, now they say I have cancer in my lungs. That's not lung cancer. That is breast cancer that has spread, metastasized to the lungs. It has created that problem, that fluid around the lungs, which causes you to become short of breath. Next. If I get this cancer, can this thing be cured? Well, cure is a unique situation, and it depends on any number of factors, I can tell you. It depends on a lot of different factors. And even when that doctor tells you, oh, you're cancer-free, let me tell you something. Don't ever stop looking after yourself. While in training in Jamaica, I met two patients that really brought shock to me. There was a lady, she was 23 years post-treatment for breast cancer, 23 years. And she presented to the surgery clinic with a fracture of her right humerus. And when we did the x-ray, it is what we call a pathologic fracture. We did the biopsy. That was breast cancer that she had 23 years earlier that had woken up again and caused her to break her right humerus. And I can never forget, it was her right arm. The second patient was someone who was 19 years later, was the mother of one of the doctors who was in training at the same time. He was an ENT. And she came with fluid on her lungs 19 years after her treatment. So you should never, ever stop checking on yourself. Never. The cure will depend on the stage of the tumor and the medication, as well as the other form of treatment. And we'll go through those. 50% or 80% of stage 1 is going to be alive at 10 years. Notice I'm saying 10 years. That's when they declare that you are cured. But remember what I said just now. This is 23 years and 19 years later when this thing turns up. And there's another factor in there that needs to be added to that equation. But nowadays they say between 80 to 98% of stage 1 cancers can be cured. I always say to my patient, that really sounds good. Yeah, 80%, 98% of the time. But turn that telescope around, 2% to 20% of those are still going to die from their cancer. What? Yes, the statistics are there. I'm not telling you anything what I'm guessing at. All over the world, they've looked at the statistics. 80 to 98% of women with stage 1 cancer, breast cancer in particular, are going to live beyond 10 years. But that really means that anywhere from 2 to 20% of those women are still at risk for that cancer to wake up years later. So don't ever stop checking on yourself. Your medication. 1/3 of the patient have a complete response. 1/3 have a partial response, and 1/3 of the patient don't respond to those medications. In many instances, people say, oh, I take that medicine, that thing really horrible, and here's my cancer to come back. The medicine ain't working. That is true. The medicine is not a perfection. They help. And again, you're going to see later on what it is that you need to be doing to really help your body heal itself. Radiation. Similarly, 10% of persons need radiation because they got chemo, they have a metastatic disease in the lymph nodes or to the bone or to the brain. But radiation, like surgery, like medication, doesn't necessarily kill all those cells. What are you talking about? Next slide. Analyze the statistics. Next one. This is the whole business of stage and grading. You got a high-grade tumor. You got two ladies. One have a high-grade tumor, the score is 3. You got another lady, her score is 9. They get the same treatment. The one who has the score of 3, she goes on for the next 20 or 30 years. The score of 9, that person in 7, 8 years, that disease flares up again, and you're using now medication that costs hundreds of thousands of dollars, and she's going downhill. But you have grading of the tumor, which tells you how bad that thing is going to behave. Grade 3, and they have 3 different characteristics. So your score could be a 3, anywhere from 4 to 7 or 4 to 6, and then from 7 to 9. And I tell you your grading. Next one, your stage. A stage 1 tumor means that the thing is confined to the organ of origin. But remember that statistics now. When I say to you, you are stage 1, I'm trying to give you reassurance that the thing is confined to the organ of origin. But even in those circumstances, anywhere from 2 to 20% of those tumors may have secretly sneaked out from that organ and has gone and lodged itself someplace else, and that none of us know about, no matter what fancy tests you do. We got all sorts of fancy tests nowadays. But 2 to 20% of even stage 1 at the time of diagnosis may have already slipped out from that organ. And stage 4 means that you have the tumor in another organ in the body. Either it's in the skin, it's in the lungs, it's in the brain, it's in the bone, it's in another organ. That tells you that it's a stage 4. And in between, you have stage 2. When the nodes are involved, stage 3 is when it's attached to the skin or the lymph nodes are attached to the underlying muscles. Next. And here again, when people tell you, well, you're cured and you take this medicine and all the rest of that, do not let anybody fool you about their medicine and music. Look at this. You're hormone receptor positive. Okay, you are ER 90% positive. What does that really mean? 10% of those cells do not have the estrogen receptor on it. So you already have 2 different set of cells. One of those cells are going to respond to one medication, that other cell is not going to. And then you look at your PR, your progesterone receptor. You are 40% PR positive. 60% of those cells do not have progesterone receptor on them. They are different. Okay, that's 200 cells. You got 40, so that's 60% of them that won't respond. And then with the 90, you have another 10%. So 70 out of those 200 cells are not going to respond to those medications the way you would like for it to. So do not let any doctor tell you, say, oh, you got this, you do that. No, doctor, listen. I hear you, I appreciate what you're saying. But when I look at my results, and don't say that the doctor is no expert. If you wish to have knowledge, there's nothing that stops you from getting knowledge. What is my ER percentage? What is my PR percentage? What is my HER2 new? Right? Because what that is saying to you right there is these cells, this isn't just one set of cells. That's 3 sets of cells you have right there. And those are only the markers we are using. Okay, so what marker are we not using? That you don't know if those cells have it or they don't have it. Okay? See, and this is why I say I would like to go find the cure for cancer, because there are lots of things there that you can find out. You just have to know what you're looking for. Unless your mind conceive it, your eyes will never perceive it. You have to think about it. Think about it. Work it out. Next. So what do I have to do not to get it? Well, I guess you got to be born into the royal family. If you come from Ragged Island, they tell us all of us related. And you know, royalty always marry into royalty, right? So, but basically, when I say that, I'm speaking about your genetics. There are certain genetic profile that puts you at risk for cancer higher than normal. And then, of course, that's only one factor. The next one is the way you live and your environment. Those things work together. We talk about our biogenome and our human genome and how those things synchronize. And you have to put those together. Next. That's your chromosomes. and human beings have 46 pairs of chromosome, 22, and then you have the X and the Y. X is female, XY is male. Next. That's what the chromosome actually looks like. The DNA is a double-stranded helix. And when that thing is working, when the cell wants to divide, you have to actually split that. You duplicate it, and then they separate. And that's part of the way that chemotherapeutic agents work. That because cancer cells are dividing so fast, if you could put a medication in there that stop that thing from dividing, then you can actually kill that cell. Because once you stop it, it may have started, and then the medication go in there, you now have a totally abnormal cells. Your immune system, listen closely, your immune system comes along and is able to take that cell out. Next. And here's one of the main problems we face here in the Bahamas, genetic mutation. In 2001, I met a young lady, and she wasn't the first one I met, the first 28-year-old in 1998, out of Exuma, with breast cancer. Her mom had breast cancer at 28. She presented with breast cancer at 28. She took off the breast, she took her chemotherapy, and I said to her, you need to do your BRCA gene. She had insurance, she used to work in Kelly's. The insurance refused to pay for her to have her BRCA gene done. She had to go to Kelso Lab and pay $2,700 to get her BRCA done. She was BRCA positive. So she decided, she went home, spoke with her husband, and he said, well, honey, breast is important, but I prefer you over the breast. So she ended up taking off her other breast, prophylactic mastectomy, took out her womb. She had 3 children, 2 boys and a girl, and she took out her ovaries. Why? Because if you look at that BRCA thing, it increases your chance of breast, ovary, prostate, as well as colon. All of those things are connected. She made that decision. To this day, she's alive. Okay? She is still alive. She has no evidence of cancer. I still see her. And this is from 2001. The other one in 1998, she actually died. But that other one, she literally is alive to this day. She was BRCA positive. Then you have other genetic makeup that puts you at risk for cancers. Those are the funny things. The leishmania, Peutz-Jeghers, ataxia-telangiectasia, and those enzyme defect. Next. And I put this picture up there just to show you that I'm talking to you in a one-way manner. That's not the way the body behaves. It's a cyclical thing. And there are many different pathways. And this is, again, one of the reasons why the medication don't necessarily work the way you want. Because the medication may work at one of those points, but those cells are smart enough to get around the way what that medication is blocking and therefore continue doing what they want to do. So you have to understand, in many instances, when you're taking chemotherapy, you're going to be taking more than one drug. Because one drug may block one thing, but you need to block more than one way of those cells communicating. So chemotherapy is always multiple drugs. And I guess you all know they all make you sick. But that's a temporary sickness. Next. And again, I didn't put Ragged Island in this picture, but see, if you're on Ragged Island, you're sitting down under the coconut tree, that's what you're looking at. If you're in Nassau and the dump on fire, I'm sorry for you. So what are you breathing? What exactly are you breathing in Nassau? And what would you be doing on Ragged Island or in Exuma, Meguana, or Inagua? See? 75% of our people live here in Nassau. Why? Because we've been miseducated. Oh, you could have a better life in Nassau. How much murder we don't have? How much murder you are in Meguana? You got a better life? Oh, okay. Today I run into 2 different accidents. All right? I can't tell you the last time they had an accident on Ragged Island. I don't even know if they got any cars up there, but anyway. Next. And just to give you an idea of country-wise, in North America, 86 per 100,000. Australia, 71 per 100,000. In the Caribbean, we got 33 per 100,000. West Africa, 19. Middle Africa, 13. In China, you got 11. Right? So Depending on your genetics, you got to marry into the royal family, make sure you don't have those genes. And if you really want to live without cancer, I guess you got to go live in China. But anyway, I come from Ragged Island. I don't want to go to China. Next, change your lifestyle. See, in many instances, this is where we've been miseducated. Oh, you could sit down, cross your leg, and you're lazy boy, you smoke the cigarette, drink your beer, get your pizza, you got your remote, and all the rest of that, right? As that young lady said, get rid of all those processed things. Get rid of those things. Why are you smoking? See? Why don't you get up? Next. Yeah, go outside. Run in the sun. She mentioned the sun in your garden. You know what the sun is good for? Ultraviolet light in the sun converts the cholesterol in your body to vitamin K. Vitamin K is what gives you your bone health. You talk about menopause and osteoporosis, go there, go walk in the sun. Early in the morning, best time to go, right? Yeah, wait till the sunrise. I always say morning, because you got the dew falling and there's no dust in the air with all them people don't spit on the ground and the dog doo-doo and all them kind of things, right? Go there when the dew is there and the sun is rising, right? I was taught never let the sun rise and find you in your bed. So you wait till the sun come up, you go there when the dew is on the ground and you take in that air, you get a little bit of sun coming up and it changes your cholesterol, which has its own set of problems, into vitamin K. It improves your bone health. You could get yourself at peace being out there. Next. Yeah, that's for you all guys. Get up. Go weigh yourself. Get to the right weight. Next. Change your diet. See? Your lifestyle has to change. When I am speaking about this, I always remind people of when I was growing up on Ragged Island. On a Saturday, my grandmother would say to me, you see that little gray Dominican? You see that brown one? That can be dinner tomorrow. I had to go and kill that chicken, put it in the biscuit tin of hot water, get rid of the periwinkle, pick it, open up the gut. I had to find the liver, the gizzard, the heart, okay? And carry that to her and tell her that's the chicken, right? That chicken was 2 meals on Sunday, okay? She cut that chicken in half. The thigh get cut in 2, the wing get cut in 2 or 3, the breast get cut into 4, okay? It was about 8 or 10 of us. And everyone has got a piece of that, right? And when evening come, that was our supper. If you do a cookout right now, you don't give the people them half a chicken. They will know why you ain't ripping them off. You ripping them off because you ain't giving them half a chicken. But guess what? The truth of the matter is you only need 3 ounces of protein in any meal. 3 ounces. Which is like half of a chicken breast. You only need half of a chicken. What you need half of a chicken for? See? And this is where Nassau has really and truly, you got Kentucky, you got all them other places selling you all this stuff. And people talk about sugar. There isn't anything wrong with sugar. It's just that it is very, very addictive. Human beings love the sweetness of sugar. And all of those recipes, they have added molasses, they've added syrup, they've added honey. That's brown sugar, it don't really matter. As long as it's sweet, you're going for it, right? Change up your diet. See, you don't need 16 ounces of a steak. You need just 3 ounces of protein, animal protein. And you don't need that every day, you know. You don't need that every day. Maybe 2 or 3 times a week, you need that 3 ounces of animal protein. Animal protein is considered protein A. It has 99% of what you need. Yes, it's excellent stuff. It gives you vitamin B, it gives you iron. But if you eat your beans, you eat your peanuts, you eat your nuts, you're getting your protein right there. You're getting it right there. See? Next. Well, if you keep eating those things, your boat can sink. It's a fact. The Titanic sink, if you keep on eating those wrong things, the boat can sink. Then what now? See, if you're there in Nassau, I guess you could call Basra. If you're on Ragged Island, 211 miles to the southeast, you could call Basra. You know how long they can take before they come? Okay. You get into trouble right now on Ragged Island, there's no light on the airport, right? You know when you're going to get airlifted? Maybe tomorrow. Who knows? So you're going to wait until the boat sink before you decide to look after it? Next. Again, plenty of y'all ladies in here, you all married. I hear some of you all talk with your husband and all of that. You spend all this money. I know what the young ones do nowadays. We used to buy those nice china plates, cups, and everything. Beautiful thing. Yeah, this is my wedding gift. And then we load it up with food. You can't see the beauty of the plate anymore. You could have a beautiful meal and on a beautiful plate and you enjoy both of them. You got to fix it in that kind of manner. Next. Yeah, keep yourself hydrated. You know, in medicine, we say water is the elixir of life. 70% of your body weight is water. But go look in your Bible again. Like I say with Adam and the female and all that kind of stuff. The earth was there, was in darkness, and the Spirit of God moved on the water. Water was with life. From the very beginning, the Spirit of God moved on the water. Our bodies work with water. There isn't anything in our body that can happen without water. Very, very important. Elixir of life. Next. What am I going to do if that doctor tells me I have breast cancer? One of the most important things to do is accept the fact. It's not necessarily easy. And again, growing up on Ragged Island, when those women, when their husband died, one of the things I always noticed as a child, they would, any official occasion, like if they had come out to this event this evening, they would have on a black dress in that first year. And in the second year, they'd come out in a black and white pattern dress. And it's only in the third year, you see them, when Easter tea comes, they'll come out in their pretty flowery dress or something like that. But for 2 years, they wore black or black and white. When I went into medical school, you know what they said? The grieving process takes 2 years. I was surprised. That's something I grew up knowing. But now here you have the so-called scientists telling you that the grieving process takes 2 years. So one of the first things you need to do is accept the fact. It's a really, really grievous piece of information. And it may take you 2 years, but remember now, while you are trying to make up your mind, those cells have already invaded into your body and they are going to spread. Yes, it's a difficult decision to make, but it's something that needs to be done. Denial does not help. Get all the information. Get it from the right source. Because there are many people who will tell you stuff. But what is the validity, the credibility of what they are saying to you? See? And I always say to my patients, I can only give you information. If God is standing at the door knocking, who am I to break down your door? I can't break down your door. I can only give you the information. You have to make that decision. You have to go and find your support. Remember, it's mental, physical, and social. Find your support and deal with the problem. And then you come back, and I'll do what needs to be done. Next. Those are the phases of grief. First of all, not me. I live a good life. Yeah, but you got some genes that your mom and your dad gave to you. You live in a good life, yes. You might be living in Nassau, but then you get angry. Why me? That evil woman down the road, that man who always fooling around all them women, he thieving all them people things. How come? How come? Well, if I do this, maybe I can get that. If I do this, I can get. You start to bargain. And then when the thing doesn't work out, that's why you see them get to that stage that I show you with them ulceration. When it doesn't work out, they become depressed. Now your mental state is something different. And finally you accept. Now, you may have started off at a stage 1 or 2, but by the time you come for treatment, you are now at stage 4. What is your outcome? See? What is your outcome? Next. How do you know if you have it? Well, that's part of what the physician's job is. You got to do the workup, as we call it. Next. History. How long have you noticed the lump? Now, you can only find a lump when it's about the size of a pigeon pea, and it has to be someplace close to the surface. That's why I showed that first picture, right? But remember, when you find that anywhere from 2 to 20% of them may have already slipped off and gone somewhere. It's only something the size of a pigeon pea, okay? So understand, and that's why I say that denial thing and that waiting, that 2 years, a grieving process, that puts you at extreme risk for not being able to be cured. And then you do a whole lot of different questions. Early menarche, late menopause, that puts you at greater risk with those hormones. And you mentioned hormone replacement therapy with menopause. That has been associated with breast cancers. Your late first pregnancy. I know nowadays with the young women in particular, they got to get their master's degree, they got to get their PhD, they got to find a job, they got to become a manager. Now they 35 or they 38 before they have their first child, right? Late first pregnancy, abortion, induced abortion is associated with breast cancer. Breastfeeding reduces your risk, right? So there are other things that come along with breast cancer. You got breast pain, funny feeling, you got discharge from the nipple and so forth. If it's bloody, that raises a flag. Next. You have to examine both breasts. And again, that picture show you that because the breast can be asymmetrical. You look at the normal breast, and the minute you look at that other breast, boy, something's wrong here, for sure. See? And you have to examine the whole body because you are looking for evidence of spread of the disease. Of course, you can do other tests, but just your physical exam can give you a lot of information. And some people who have high blood pressure and diabetes and so forth, you got to check out their heart because chemotherapy can have a negative impact on your heart. Next. Biopsy is what really gives you the answer. You need to do a biopsy. Next. Different ways. Needle biopsy. You get fine needle, you have true cut biopsies you can do. Next. Same thing, needle biopsy. Next slide. That's the beginning of surgery, actually. Next. That's your mammogram screening test. Very, very important. Next. And this is how you're going to treat it. There's a fractional reduction in the mass of cancer cells. And I say it like that because if you listen to those folks out there, they all seem to think that, oh, what I am doing is what can do it. What I do and what I... No. There is no perfect treatment for cancers. None. Because like I've tried to point out is that all those cells are different. And even at the earliest stage, as a surgeon, I may say to you, oh yeah, if you do this now, you... No, I'm not going to fool you. Up to 20% of your tumor may have already spread by the time you find it. And I can give you a funny name. There's something called Gompertzian maps, which tell you how those tumors divide. They are dividing most rapidly before you even see them. That's when they're dividing at the fastest rate. And after you find them, they're not dividing as quickly. Now, they still may be high grade, but that rate of division is not as high as it was before you ever saw it. See? So, surgery, chemotherapy, radiation, hormonal, immunotherapy, all of those, they do fractional reduction. All of those cells respond differently to different treatment. And you have to understand that. So, basically, your therapy is going to be a plethora of different things. Next. I put Princess Margaret Hospital there because the majority of people go to Princess Margaret. Next slide. And then I put this there because, and this is from 2016, this isn't even recent. And they have some really, really new drugs nowadays. Kidsala in particular. That thing costs $15,000 per treatment. And you hear them just say, if you ain't making $10,000 a month, you're a pauper. In Nassau, if you ain't making $10,000 a month, you're a pauper. You're a poor person. You're not even middle class. You got first class, middle class, low class, right? Well, if your treatment costs $15,000 per month, I don't know how you can deal with that. If you can't even live, now you gotta, on top of that $10,000, you gotta find $15,000 for your treatment. And we like to say to our people, everything free. And I always say to people, salvation even ain't free. Jesus paid it all. It was paid for. And he's asking you for his loyalty. But it was paid for. See, when they tell you about things free, all that means is you ain't gonna get nothing. You get absolutely nothing if you pay nothing. Okay? So stage 1 cancer, 2016, $71,000. And you usually treat that thing like within 3 months, because you do it every 3 weeks. That's 12 weeks of treatment, right? 3 months, you got to come up with $71,900. Okay, in 3 months. You got stage 2, you look at $97,000. That's the same treated 6 months. Stage 3, $159,000. And stage 4, $182,000. Okay? Who got that kind of money? You tell me who got that kind of money. I always tell them, if you got that, I'd like to know where your tree is, because I'd like to come pick some of the money too. Right? But that's what you're looking at. And I can tell you, that's 2016. And we have some new drugs nowadays. Ibrance, we got Kitsala, and there's another one, I've forgotten the name right now. But those things cost anywhere from $12,000 to $15,000 per treatment. Okay? Yes. Next. And then people say, I ain't got no money for that, and everything only break you down. All right. The other stuff you're doing, is it building you up? Next. Always they say that. I remember the patient said that, oh, he got the cancer and it spread. You know why they say that? Like I say, 2 to 20% of them may have spread and you don't know. So you go in there, you do the surgery. Clinically, you don't feel any lymph nodes, but when you get back your pathology report, it says 1 out of 15 lymph nodes are involved with tumor. Oh, so when he cut it, he caused the tumor to spread. You didn't cause the tumor to spread. You just exposed the fact that the tumor has spread that you didn't know. That's what you're really revealing at that point. But anyway, gossip, serious thing. Father Brown, Christ the King, he always told the story about the black angel. He said, God ain't got no black angel, because when he tell them go to the well with the bucket to bring the water, they just be beating the drum and doing John Canoe. So they don't ever come back with the water. Anyway, you have to be careful who's telling you the story. Next. Again, how will I look when my breast is gone? My husband loved my breasts. What is beauty? See, one of the things that always make me laugh is this. Most people, when they look at me, they say, I thought he was a tall white guy, he was a foreigner. No longer than yesterday, a 91-year-old woman, she looked at me, she said, I thought he was a big fat guy like so. I laugh at her. When I say, her name is, somebody your name, Johnson, Doris Johnson. I say, lady, you don't read your Bible, eh? You never hear the story about David and Goliath. David don't have to be big. Don't have to be big at all. Anyway, we have this misperception about beauty. See, if you ain't got nice curly hair, and if you ain't got a straight nose, and you ain't got no nice thin lip and so forth, you ain't pretty. See? Next. What I can look like? Well, if you take off both breasts, you can look something like that. All right? Next. And you try to tell me that girl there ain't pretty? I look like a nice looking girl to me. She ain't white. Next. Next one. See? Beauty's in the eyes of the beholder. Next. Yeah, my husband wants my breast. Did you actually ask him what he wants? Did you? Or you just assume? Right? See? And again, this is where the support is important. That's why I give you the story of that young lady at 28. She went and she spoke with her husband. Them two still married to this day. Believe you me, because I see her all the time. When I go into Kelly's, she's right there. Right? She went home and she spoke with her husband. And they made a decision. And to this day, this is from 2001, them two still together. Next. What about the alternatives? I got my herbs, garlic, carrot, molybdenum, selenium, charcoal, noni juice, gold juice, cerasee. What are your options? It's a real question. Next. You got your aloes, you got your moringa next, you got your soursop, and then people talk about sugar, right? I tell you, those things actually work, you know. Listen closely. Those things work, but they don't work when you are sick. When you talk about lifestyle change, if you're going to take moringa, you're going to drink pear leaf, or you're going to take soursop or whatever, you need to do that, just as Dr. Spence say, 3-4 times per week. Every medication, just about every medication that we use, come from plants or come from the environment, and they're found right in those things. But when I give you an aspirin, I'm giving you about 1,000 milligrams of salicylic acid. If you go down by the river, which is what the Indians used to do until the British saw them doing it, they used to get the willow bark, they used to heat up the water, put the willow bark in the hot water, and they drank that for fever. They took that willow bark tea and turned it into aspirin for fever and pain. Adriamycin, the red devil, where do you think that comes from? Fungus. You look at the fungus, it produces adriamycin to stop any other fungus getting into its territory. Adriamycin is a cell-killing agent. I grew up on Ragged Island again. We had our periwinkle. The big thing when I went to Jamaica, we started talking about acute lymphatic leukemias in little children. They use vincristine and vinblastine. You know what is the scientific name for periwinkle? Vinca rosa. Vinca rosa is the name for periwinkle. Vinblastine is a medication that's made from the rose, the flower of periwinkle. Vinblastine, vincristine. So all of the medication traditionally comes out of those bush. They have the medication in it. But those things aren't to be used when you are sick. You need to drink your moringa tea or eat it every day or every other day. And that assists your body along with your dietary change, your water, and your exercise. Those are the things that keep you healthy. Why do you think them people on the islands live till they're 100 and y'all in Nassau is be dying when you're 18 and 19? But not from cancer, but from gunshot and road traffic accident. But those old folks on the island, they're drinking their parsley, they're drinking their rampon bush, they're drinking the tamarind leaf tea. They're drinking those things every day. See? Whereas you drinking, I don't know what you're drinking, Starbucks and all them other places, right? See? But on the island, those people are taking those things on a regular basis. They live in a clean environment. I used to walk to school. Never drove in any air-conditioned car. You was out in the sun. See? But in Nassau, everybody in air conditioned, they drive in one car, you putting out all kind of fumes from that car, just like the dump, you breathing in that stuff. You have to be unhealthy. That's why those old people on the island live, you wonder, well, how come they still doing this? How come? Because they living healthy and they drinking their bush tea. That's what they doing. But we only want to drink it when we are sick. No. You need to drink that long time before you are sick because they actually help your body to defend itself. They work. But when you have stage 3 and stage 4 cancer, you need the real drug. You need the poison. And people talk about sugar. As I always say, sugar cannot enter your body. Sugar is something called sucrose. It's a disaccharide. Your body breaks it down into glucose and fructose. It is the glucose that actually enters your body. Glucose is sweet too, but I don't think any of us ever taste glucose because nobody sells glucose like that. Yes, I see it in the pharmacy sometime, but it costs so much money compared to sugar. Sugar is sweet. But sugar doesn't enter your body. Your body digests it, the disaccharide become a monosaccharide, and the glucose is what goes into your body. But guess what? When you eat your yellow yam, you eat your sweet potato, you eat your whatever them other things, rice and so forth, those are starch. Starch is a polymer of glucose. So you're taking in the same thing what those cells use, and every cell in your body uses glucose. Believe you me, cancers don't even see any sucrose because it can't enter your body. The only thing cancers use is glucose. That's what every cell in your body uses for its energy, glucose. And glucose is what starch is. It's a polymer of starch is a polymer of glucose. You have to control your diet. See, it isn't just about, oh, well, you do this. No, you have to know what your diet is supposed to be and follow that. Next. What are your options? Again, like I say, you could decide you're not going to do anything. But while you're not doing anything, it doesn't mean that tumor is sitting there waiting for you to make a decision. You could decide, well, I'm going to keep my breast. Yes, that's possible. Once the tumor is less than 2 centimeters, if you have no nodal disease, you got to take your chemotherapy, you have to take radiotherapy. But remember what I said now. Chemotherapy may cost you $18,000 in that 4 weeks. On top of that, if you do breast conservation, you got to find another $20,000 for your radiotherapy, because that's a mandatory part of breast conservation. Okay? Then you can decide, well, okay, I'll take off my breast. If you do that, in many instances, you can avoid certain other form of treatment. This may be an advantage of menopause. If you're menopausal and you are hormone receptor positive and you do a mastectomy, the only thing you need to do is take some Arimidex tablets. Tamoxifen is cost you $1 a day, $30. That's all you need to do. $30 a month and you're straight. Arimidex is a little bit more expensive. It costs $10 a day. Okay? So taking off the breast has its advantage. Keeping the breast has advantage too, yes, mental health, but it carries with it a cost. You can decide you can take off both breasts. Why? Because you're at risk. And again, experience have taught me, I have had patients who present with bilateral breast cancer from the day they walk through the door, and the oldest patient I've had is like 30 years later. She was 62 when she was diagnosed, and she was 92 when she was diagnosed with the second episode of breast cancer. So up to 30 years later, you can come back with cancer in that other breast. You have to factor all of that into it. Okay? And radiotherapy, and like I say, nowadays they have all these new medications. Next. And again, like I say, what is health? All of this information is there, but you have to figure out what really is it that I need to have done. It's your mental, physical, and social well-being. Mentally, and this is where imaging, body images is important. And they talk about Barack Obama and his health input. Insurance companies refused to do breast reconstruction before 2006, 2008, right? They said, oh, that's cosmetic surgery. When he came into power, he actually caused them that to be a part of the treatment for breast cancer. So you can have reconstruction with breast cancer now. That's part of your mental health, which is very, very important. So, and physically, obviously, you got to be well, and socially, you got to have your support group. I guess your significant other is probably the most important part of that, but your family and your friends got to be there for you as well. Next. What is it? I guess we're coming towards the end. What you need to take home? Breast cancer is a common thing here in the Bahamas, very common. You have to know your risk. You have to be able to check yourself. Because you may come and see me for half an hour, 45 minutes, but you have your breast every day for the whole year. You showering, I know y'all women like to shower. While you're there showering, feel your breast. Check under your arm. Oh, I know expert. Yeah, but after 365 days of doing it twice a day, because you always bathe twice a day, pretty much you'll know that something is going wrong or something is happening in your breast. After a week, 2 weeks, hold on a second. What is this I'm feeling? This don't feel right. And the next thing is when you go see the doctor, don't let that doctor tell you nothing wrong with you. Doc, I feel something in my breast. I didn't have this during Christmas. This is now Valentine's Day. I'm feeling this thing. I need you to figure out what this is. And then you should act. Don't delay. Because them tumors, they're not delaying for any reason. Next. Basically, that's how you should be doing it. Look at it. like I say, symmetry is important. Now, some of y'all, I know you say one breast is larger than the next. That's fine, that's normal, okay? But you need to know what your breast look like, because when that tumor is there, it causes congestion. And it can cause the one that's impacted is probably going to get bigger than the one that doesn't have the tumor at the time. When you put your hand up over your head, you're looking to see for skin tethering. If something is holding down the breast, you're going to see one of them going up higher than the next, or you're going to see that skin dimpling. So very simple things. Very, very simple. You don't have to be no expert, right? You only have to be able to see. Unless your mind could picture it, your eyes will never see it. Next. On Sunday morning, when you're not going to church, or Saturday, you lay down, put your hand up behind your head, and you feel it. You flatten it out like the pancake. Because if you do it while you're standing up, you're feeling both sides at the same time, and you could miss something. But if you flatten out the breast, you're more likely to pick up something there in the breast itself. Next. Well, that's really the end of it. Life is a journey. You don't know where it's going. If you jump in the bush, what you gonna run into? If you go across that chain fence and jump that fence, what you gonna find over there? You can find a lion, a pit bull, or a Rottweiler, what? Even though you can't see the end of it, you walk the journey. That's the key. Yeah, you're going around the bend. Who knows where you're going? But just follow the course. Next. Never ever give up. Next. Life is always beautiful. Thank you very much. Next. All right. They're getting there slowly, but see, I don't want to share my intellectual thoughts just like that. Because the sickle cell thing, they have come close to solving it. And I've been thinking about it from 1978. They've come close, but they haven't gotten to the real point. And they have improved the treatment for cancer. Like, you see that Herceptin thing? And the Taxol come from the yew tree. It comes from plant, it's plant-based again. They have combined Herceptin with Taxol. So yes, you have hormone receptor positive cells. And then you have Herceptin, which is an antibody. And literally, they have combined Taxol to the Herceptin. So it is a more targeted, it really and truly finds those cells that are HER2 positive, not only block them with the HER2, with the Herceptin, but it also carries the Taxol to those cells and kill them off as well. So it is improving, but, and I can say the rest of it, but anyway, that's what I'm actually going to do. Yes.
You mentioned earlier about diet, and we look at the numbers and saw that the Chinese, what happened in China, their numbers are a lot lower. And other than the Chinese out here in Africa, look at the typical Chinese diet, it consists of a lot of fruits, vegetables, nuts, greens, stuff like that, is very unique. And you may not, I'm just wondering, seeing what's happening here. I mean, when I go up, my grandmother knows they things like sour bread, these kind of things like this. Majority of our diet is changed. We no longer eating a lot from the ground. We're eating a lot of processed foods and all these other kinds of things. Seeing the trajectory of what's been happening now in terms of the growth of cancer here in the Bahamas and with the diet and everything else. Yes, the insurance companies are making paying more, making more, the doctors are making more and everything else. Why do you think there's not more education on what our typical diet should be? And also, is there a way that even Now, I believe we can look at all these bad influences that are coming into our island because in the long run, it's really gonna affect us more than anybody else. You know, it's gonna affect our lifestyle. I mean, everywhere you go now, there's a liquor store, there's somebody selling fried chicken or these other things are all contributing to that. Making money, but at the same time, you know, the health is deteriorating. How do you think we can do more to strike a balance with that kind of situation going on?
Well, I can tell you that one of the main reasons why we are influenced by our food so strongly is because they market their food. We don't market health. You understand what I'm saying? Kentucky, Starbucks, Burger King, all of them, Wendy's, they actually support a lot of things. They tell you come and do this, and they're going to put their brand out there for you to come and buy those things, and they are competing with each other strongly. Now, again, I can tell you something you may know or not know, but all of those brands are actually under one company right now. So they are simply marketing themselves to make money. And unlike, like you say, when I was growing up, what you ate, the majority of it, you had to grow. We had something called gunpoint. We had to go down gunpoint to pick our peas and our pull back guinea corn and that kind of stuff, right? Lima bean. We had our dry corn hanging up when it come hard time, right before winter over. We used to have our stuff hanging up in the kitchen that we ate. We never had anything coming out of the food store and all that kind of stuff. And a lot of the time, you hear me talk about that chicken. Those chickens used to let them out in the day. They used to go find their insect and thing to eat. Maybe once a week, we fed them some kind of food, but they live off of the earth. They didn't live off of any food that we were giving them. And they certainly didn't get any injections or any such things, right? So, and this, people talk about Bill Gates and them controlling the world population. I guess when I was growing up on Regular, we had about 600-700 people there. Now we got about 70 people because we all come to Nassau. But we had sufficient food on there. We used to grow our sheep, our goats, the ducks, the chicken, the turkeys, the pigs. So a lot of the families had to, and if my family killed a pig this Saturday, that was sold to the whole village. See? That was sold to the whole village. So it wasn't any pig that was basically you get from somewhere, you don't know where it's coming from. Everybody know where that pig come from because you had that from that was a little whatever, right? Piglet. So, but nowadays we are getting our food from a generated system where they trying to, like, you know, them chicken, I always remember those little chicken when they born, they used to be running around behind their parents, and then you see them get their little hard feathers, and then finally you see them leave their parents. That used to take weeks. Nowadays, within 6 weeks, the little chicken were born, they selling that to you. How come? That is not natural. Something is unnatural about that. See? I'm not saying science haven't progressed, but like everything, like I said, there's good and bad in everything. So what you are doing to these products, and it's not just the animals. That's why you hear them talking about genetically modified fruits. As far as I know, every fruit supposed to have seed. Where you get these seedless grape thing from? What did you just do to make the thing seedless? Where did that come from? See? So we are doing things, and yes, it may be feeding 7 or 8 billion people, but it also having negative impact. And then those people who are making those things because they have invested funds into them. When you talk about making money, it's why the drug companies charge all that money. They have invested monies into developing those things, and they want the returns on their funds. So they are going to push it, and they're going to tell you that your thing isn't worth it. You need to buy this. But like I say, go back, go take your aloe, go take your moringa, or whatever it is. You only need to take that cancer thing if you get cancer. But if you live a healthy life, and I mean really live it, not halfway, you live a healthy life, you can stop yourself from getting a lot of things, right? but it's marketing really and truly that's doing it, right? And we don't really push health like that. We don't. Health is not marketed. They put millions of dollars in the marketing. When you get Super Bowl, when you get NBA and all of them things, you see the ads they put out there. You ever see any ad for health? Have you ever seen an ad that push in health?
One more question from somebody new. I call you my last question. Okay, you talking about gene genetics and stuff like that. Because some people they do all the stuff like being healthy and all that, and they still have cancer. So how do they explain the genetic situation with that? All right, and also secondary, the environment. The environment also seems to be pertaining to being from regular and Nassau, right? This is how the negative effect on persons in Nassau versus the family that it's not a same that. Because I mean, we live in a very religious country, and sometimes you can't control the smoke emissions from the bus or the emissions from the garbage dump. So the government is not doing anything to stop these things. So people are at risk of a lot of health ailments. And then the place, of course, when people get sick, that's another thing. So if you explain to me about genetic situation, and even if you might follow all the health things you're talking about, still people come down with this. Is this based on family history, genetics, or born in the wrong family? I don't know.
Well, I mean, you're not born in the wrong family. I say it like that so you could remember the genetics, right? But see, the way your body is created, things are going to break down. But it's created in a manner that it has the capacity to repair itself. And you see that BRCA gene? That really is a DNA repair gene. That thing actually, if DNA is damaged, it goes along, and whatever that damage is like your window not working or your shingle blew off your roof. That gene creates a protein. You have your DNA, which have the genes in it. You have intron, you have the gene, you have the exon, right? See, now you get me to go into some stuff. That one I didn't answer a question, right? You got intron. Well, first of all, you got to split that double helix to get at the gene, right? You have an intron that tells you, okay, this is where you're going to enter. Then when you get here, you're going to start printing the gene. This thing is going to give you something that we call mRNA, messenger RNA. That messenger RNA goes to what we call a ribosome to produce a protein. That's the workman. That workman is now going to go there and fix what is broken. That's what your genetics is all about. So even if you're living healthy, but you have that mutation, you don't have the capacity to repair your damage. So it's going to continue. That's why those genetic things perpetuate or basically cause you to develop cancers. And there are many of those that we have figured out that causes those things, right? So that's why the genetics is important, because you have a defect in a gene that repair the DNA, or a defect in a gene that allow your immune system to function the way it ought to. Because yes, you may have normal genes, but if a cell becomes abnormal because of an environmental impact, let's say you get infected with human papilloma virus or hepatitis B virus, human papilloma is going to give you either cervical cancer, it could give you throat cancer or something like that. But if you have an immune system that can kill off that cell with that HPV virus, then you're not at risk. But if your immune system has a deficit, in other words, you don't have no vitamin C, you don't have no vitamin K, you don't have your zinc, which all help your immune system, right? Then that HPV is going to be able to perpetuate the cancer. See, so it's not one factor. There are many factors. Genes are important, but environment and your diet and all the rest of that is also important. And when you talk about, and that's why I show you that picture of the blue sea and the coconut tree and the smoke from the dump, a lot of what comes with the fossil fuel is something we call anthracene. And I don't know if you remember when they had that leak down there on Robinson Road by Rev. You're right. You know how many people develop colon cancer right there in Marathon? right? Because when you look at it, anthracene and diesel, anthracene is one of the end products of burning fuel, fossil fuel. That thing causes bladder cancer, it causes lung cancer, it can cause colon cancer. So on Ragged Island, you laugh when I say you ain't got no car up there. Guess what? You don't have no exhaust fuel. Yeah, you got your boat, yes, but them boat going out in the sea and the wind blowing, right? Here in Nassau, we got hundreds of thousands of cars that's pushing out fossil fuel. And every day you breathing that stuff. See, you got BPL, you got BEC, right? That thing producing all kind of rubbish down there, right? No, I say that simply because why is it that we're not using solar? Why is it that the government hasn't put in place a public transport system that actually works? See? So, and you know why they haven't? Because us payment people, like I say, you talk about marketing. How we actually said to Brave Davis or Hubert Ingram or Hubert Minnis or any of them, look here, we need a train system, we need a bus system, and instead of you having 3 people in a car, you could put 20 people in a bus, and guess what? You could leave Coral Harbor and get to Paradise Island on time for your work, as opposed to what will happen if you don't have your own transportation. See? So that problem, like I say, first of all, why do we have 75% of our population in Nassau? And Meguana, Ragged Island got 70 people on it. Meguana, I don't know how many they have. Cat Island got what? You try to tell me nothing on those islands? There's a whole lot of things that you could be doing. You could be producing your own food. You could grow your corn, you could grow your peas, you could grow your peanut, you could raise your sheep, your goat, your duck, your hogs, everything. Instead of buying them, oh, this is for export only. It comes from an FDA approved farm, but it's not approved by the FDA for marketing in the United States. But they can sell it to you. Oh, hold on, why are they selling it to you? Why? Because it's not fit to be sold in the US. You stay there. See, and this is where I thought we miseducation. We talk about politics, but politics is supposed to do what you're supposed to do. We need to distribute our people back to where they come from. That's what we need to do. You don't need to live in Nassau. You don't. Like the man said, a lot of problem you're in is because you're living above your means. But guess what? If you out there fishing and farming, you get your food every day. When I used to go fishing with them guys on Ragged Island, we used to give away fish all the while. You had so much fish, you sell it, yes. Or take that for auntie so-and-so, take that for uncle so-and-so, because you got so much fish. Guess what? Who was hungry? You ain't hungry, you get down now, so, oh, you know, I got to spend $20 on this thing, I got to spend $30 on this. No, you go back to them island, you ain't competing with nobody for nothing. See? So, no, we need to change what we do, and we need to they need to improve the farming in this country, they need to improve the agriculture in this country, and not just talk, they can be important things through Bahamas Food Service and all them kind of people there who bringing things from all over the place. We could grow them things ourselves. So the genes is one thing, but the environment is also important, okay? And like you say, one of the main contaminants is those same fossil fuel, believe it or not. It's one of the main contaminants. Yes.
Yes. Now, the big thing is, based on this presentation again, so we see that yes, based on this presentation, what are three key things you can do to prevent breast cancer? 1, lifestyle. 2, exercise. She's going into lifestyle. She's listening there. Besides lifestyle, what else? Examining breast, early detection. What else?
Dr. Monroe, we want to say thank you. I always tell people I hate that word, that C word. I hate that with all my heart, all my soul. I want to thank you for educating us, and males do know that you can get breast cancer as well. I attended 2 male funerals already with breast cancer. So it's not only for us, and we want to thank Dr. Monroe for informing all of us and educating all of us here this evening. So on behalf of our pastor in his absence, the elders, also members of this great church, our women's president, Sister Hannah, and Nurse Anna, we want to say thank you for taking the time out of your busy schedule to be here with us today. Thank you, Dr. Monroe. Are you sure or like?
All right. Right now, we are just delighted to have Sarah Wallace from Sister, breast survivor, and she's here in person to share her story. We can't talk too long now because we're past our time. Yeah. So, Sister Wallace.
One of our founders, Mr. Monroe. It's a pleasure to be here in your presence. My name is Leo Wallace. I'm going to keep it very brief. I was diagnosed during COVID. And during that time, it was hard to get into the hospital, hard to get a mastectomy, hard to get a biopsy. Everything was a struggle during COVID. But for me, what I found out was regular breast examination. I didn't feel the lump in my breast, but I felt the lump under my arm. And by the time it got to under my arm, I was a stage 3 in the breast and stage 2 under the armpit. I would say to everybody, I was in the shower feeling this lump growing. It just so happens that I had a niece who's in the medical field. She said, Anicia, I'm going to get somebody to check it out for you. And we went through the process of having somebody checked it out. And one person led to another person who knew another person who knew another person. At that time, COVID, as I said, I was stuck in lockdown. And during COVID, a lot of lifestyle changes were made for me, especially going from having an 80-20 insurance to having none. So by the time I was really diagnosed with cancer, yes, ma'am, I was in pain. So I'm saying this, if you have a little insurance, please keep your insurance, keep up with your insurance, because this thing called breast cancer is costly, as I was saying, right? So I was diagnosed with invasive ductal carcinoma, and I did not have the lump or the swelling or the bleeding of the nipples or all of that other symptoms. Only symptom I really felt was the lump underneath in my armpit. I, at that time, opted for, I wanted a bilateral, but something was going on in the hospital. They said, well, we can do a lymphatic and we can just take the lumps out through a lymphatic. Pressuring my doctor, I said, take that whole breast off. I'm well over 50. Please take that off. I don't need it. So when I got up with one on and one off. I was a little bit disappointed, but hey, that's a start. I went through chemotherapy, which is, as I said, it's everything with this illness is costly. I had chemo, the adriamycin, the Taxol, lost all of the hair, lost weight, lost everything. Days I didn't feel like eating, but my support was perfect. I had more than family, more than friends. Strangers even came out to help me. And as Dr. Monroe said, that's supporting him and a mental state of mind. My thing is, I'm going to beat cancer, and today I'm 2.5 years a survivor. I had the chemotherapy, which I said was costly. Turned around, I went to radiation, another $20,000 in radiation. Turned around, they looked at me and they said, oh, you're HER2 positive, and we didn't give you a type of medication that you needed during your chemotherapy. So they put me into another 18 months of treatment called Herceptin. That medication is $2,778 every 21 days. So we are up to almost $54K. I'm letting you know that being a survivor is not always about the financial, but it's also the support. And I'm going to tell you, please take your insurance. If you feel you have a lump or dryness of the breast, do not put lotion and don't go with the Vaseline grease. Please seek a doctor's advice, because early detection could limit the course on all of this. As I said, nothing was wrong with my breast. It was just the pea size underneath the armpit that I had. And from that, I'm just basically coming out of my last set of therapies, hormonal therapy. Now they're looking at me and say, okay, you're HER3 positive. So I'm telling them I'm not keeping up with them any longer, but I'm glad to be alive, and I can tell my story today. Okay? So any questions, anything you want to ask? Because Dr. Monroe really explained it a whole lot, as he said, do your examinations. If you're insured, please hold on to your insurance. I know things is not where we want it to be, but you go from one phase to the next, okay, especially with breast cancer. For me, it started with me about 26 years ago, where they found that I have cervical. And I went through all of the carrier therapies, and now this is some 24 years later that is in the breast. So my father has the gene. His sisters passed away from the gene. His nieces, them dying from the gene. But I'm going to leave that gene on that side of that family because it's not for me. So I have a daughter who's 26, and when I was diagnosed with the ovary cancer, I got pregnant, and they said it slowed the growth. To her, I could say thank you, because right after I had her, I went into my cryotherapies, and I was cured after that. Then it was the endometriosis. So we as women, and most of these were basically from side effects from birth control. I was on something called the Depo-Provera for almost 30 years. So when I decided to get off the Depo-Provera, this was flooded with a lot of other illnesses along that. The Herceptin now has an effect on my heart, where I'm fighting cancer to creating a heart problem. And with the Herceptin, right now, my heart does not pump, my diastolic does not bring in enough blood for the systolic to pump it back out. So I'm always tired. I am tired. But this too is going to be a change, because I have, as a survivor, I have now changed my diet completely. I do a lot more exercise than I used to do. I talk to myself also. As I say, talk to your plants. I talk to myself and my plants. And being a survivor is a struggle every day, and a lot of people don't understand. Sherry is saying, mood changes. Where's the attitude coming from? You don't realize you're producing or projecting an attitude, but all of this is a part of going through premenopause, menopause, and cancer. Okay? Any questions? I went through the government system. Government system is saying to you, presently today, you need chemo, you need to come up with your first $500 for every chemo treatment that you go through. Okay? You get a little bit of assistance, $5,000 from social service towards your radiation. You have other organizations who will give you a donation towards some of your bills. PMH is not free. Okay? So you have that bill still sitting, I still have that bill sitting there. Me, I moved out of my house and put that on rent to generate, along with my income, to pay for this drug called a Herceptin. I had family support. I have a total of 6 living siblings. So whenever I had treatment, I would give an extra $600 here, or an extra $300 there. I had friends who said, well, anyhow, I know you're tired. Here's a meal here. Here's a meal there. So it's actually I had a very good support system. So I'm going to tell anybody, get connected, get plugged in, say hello, because today it's for me, and today it is for you. It ain't no more tomorrow. It's today. Anything else? Okay. It's fine. From my study of what you're talking about, they're saying now bra with underwire is not good. So I'm thinking now, the purse had that metal that could drop metal into your system unknowingly. It's not good. It's just like with certain type of radiations, it's not good. But some type of radiations is good, because you have a lot of people who now place their phone in their chest or other type of electronic devices which generates a different type of radiation that is still not good. Okay.
You can get that through any of the private labs. They would have to send it overseas, and it will cost you somewhere around about $7,000 now. Yes. Now, they have a different profile. It's not as limited as the BRCA, and because of the research that they're trying to get done, the drug companies actually support it. You could be tested now for about $600. You can have it done for $600. It wouldn't just be the BRCA, it'll be about 4 or 5 different genes that they'll be looking at. Yeah, right there. I think if you go by Conwell Brown Place, the Heart Center, they do it there, yeah. But last year during the Christmas, they had a program through the Cancer Society where they did 1 week of BRCA testing here in Nassau and 1 week in Freeport. So they had a program where I think it was entirely free, because AstraZeneca or Eli Lilly actually sponsored it. Because, like I said, they keep on generating new drugs, and they want to know what is the background for the disease. So if you listen out, because December is 2 weeks away, they may come back with a similar program again. Yeah.
Thank you.
Sister Wallace. I want to say thank you. Thank you for being so brave enough to share your testimony with all of our sisters and brothers here. May God strengthen you, that you continue to be a testimony in this world today and Bahamas at large. We want to present you a small token of our love and appreciation. We want to say we love you, thank you, and God bless you.
What a wonderful time we had here this evening. Wouldn't you agree? Yes, we got to laugh a little bit, but it was quite sobering for me. The reality of it is we are not exempt from any of this, and I think we covered two very heavy topics tonight. Most women in here, might not be all, are experiencing real experience or have already gone through our experiencing in menopause. And then he said breast cancer, none of us are exempt from that either. So early detection would lead to prevention. All of these little things we need to take into consideration. But thank you so much for coming tonight. Trinity, what do you say about this? Let's get them up. Thank you, thank you, thank you. I know some people had to leave you a bit over time, but right now we're just about to wrap up. We certainly want to thank our... Thank you. Thank you so much. Thank you so much. We certainly want to thank those persons that have participated on our program tonight. Those from Trinity, thank you. We want to thank our presenters in the person of Dr. Misty Spencer Prince. She spoke to us tonight on menopause. She did an extremely good job. I was more informed than I was before, and I'm just grateful for the information she shared. We want to thank Sister Sherry Larimore and Elder Doris Johnson for sharing their testimonials with us on menopause and their experiences. They varied, but we are all different, so we probably will experience it differently as well. We want to thank you, Dr. Loxley Monroe, for taking us through a very in-depth study on breast cancer. Amen? And we want to thank our representative from the Sister. Listen. Our prayers continue to be with you as you go through your experience. Thank you for being brave enough to stand up here and tell us what you are going through. Because sometimes when people sick and going through things, they like to keep it to themselves. But I'm so happy because what you have shared and helped us is able to help us to better look at ourselves and say, hey, maybe I need to do this a little bit more. And, we better overlook things. So thank you so much for being so open with us. Thank you for coming, taking time out your schedule. Thank you, Doc. Thank you all for coming, all our visiting friends. And we trust that you would have left here with more information that you had than when you came. So once again, I just want to tell you from the depths of our heart, on behalf of the Women's Ministries Department and our Health Ministries Department, thank you, thank you, thank you. Just so you see who our Health Ministries leader is, she was here all night on the floor, but Sister Anna just stand and say hi to the people. Yes, we love collaborating, and we hope in the new year to bring you some more health tea tips along with the health seminars. And so please, when you see the flyer out, tell your friends, and you come and you bring somebody with you. So once again, thank you. We're going to close it now with prayer, but we want to tell you that we have a little refreshment for you in the fellowship hall. So before you leave, please make your way there to get a token of our love and appreciation for you, okay? So we're going to invite our elder who has oversight of the Women's Ministries Department to come to give us our closing prayer. His name is Elder Leonardo Ferguson. Give him a hand as he comes.
Thank you. Let us stand as we pray. Heavenly Father, we are so grateful for this opportunity to come and to learn more about our bodies. We thank you for the knowledge that you would have impressed upon and given the different presenters. And I pray that as we would have learned and apply it to our life, we'll change, and we will spread it to our neighbors, our friends, our co-workers, so that we can have the holistic health that you desire of us. As we leave this place, now from your presence, take us home safely, bring us back here on Wednesday night for prayer and praise service. This is our prayer in Jesus' name. Amen.
As you leave, we have that's a little slip out to the front. We were live streaming on YouTube. It will now. It wasn't being shown during the sessions, but you can see it or tell somebody about it. If you're interested, just leave your name at the front, an email address or WhatsApp number, so we can get it to you. Okay, if you are interested in viewing the YouTube live stream.
If you want to view the YouTube clip, you can just go on YouTube and look for Trinity SDA Adventist Church, Nassau, Bahamas. And it should be up by tonight, tomorrow morning. All right, so Trinity SDA Adventist Church, Nassau, Bahamas, and you'll be able to share it with others as well.